It does in fact work for acute pain. The data is very clear. And no, I'm not saying this because I want to avoid writing opioids. Saying I want to believe this medication works to avoid writing opioids is an assumption that's false because I write for plenty of opioids. A recent example of why this medication may be very useful is because I had a chronic pain patient who came in, needed a surgery, got the surgery, and I was consulted because this patient was a little complex for their pain needs. And I noticed that the primary team hadn't restarted this patient's home buprenorphine. So what do? I come in and I'm like, well, let's start for one and get their basal level of home opioids on board. So that's what I do. I give them their opioids back because they need it, because they just had surgery and they have chronic pain. Top of that, we also do some IV Tylenol, do a little IV Toradol, which is great. The patient, I talk to them, they want to avoid gabapentin, didn't have a good experience with it, but they also do not want any more opioids. They requested to have no more extra opioids to cover the pain. So they wanted to exhaust all the other non-opioid options. And this was from the patient's preference. So we talked about ketamine and all these other things. And well, this medication came up as a non-opioid option to maybe help take the edge off and get the pain down from a 7 or an 8 to a 6 or a 7, where the patient said they would be comfortable at. So it's not me that wants this medication to work. It's some patients, even some patients with chronic pain who are having acute pain, want to try this medication. But this medication is only approved for acute pain right now.